But I want to find out why some patients fare better than others if they do become infected. Dr Marina Soltan has been investigating the different factors that have influenced COVID patients' outcomes in my native city of Birmingham.
This study looks at just over 400 patients who were admitted to a hospital in Birmingham with coronavirus. And the study then goes back to look at where those patients were admitted from, their underlying health conditions or comorbidities, and their ethnicity. And what we can see is that patients with comorbidities were more likely to require admission to hospital than those who don't have comorbidities.
So the more healthy you are, the higher chance you have of surviving this virus?
Absolutely. Patients who present to hospital, test positive for coronavirus, are 1.8 times more likely to die if they have underlying high blood pressure. They're 1.7 times more likely to die if they have underlying diabetes, and twice as likely to die if they have underlying ischemic heart disease. So our underlying health has a significant bearing on our outcomes from the virus.
So this is already making me terrified, because I'm seeing two things that are directly related to me, which is chronic kidney disease and hypertension. And there are high levels of hypertension, of high blood pressure, high levels of chronic kidney disease in Afro-Caribbeans. You know, this is kind of personalising this. This virus seems to have my name written all over it, which is slightly worrying.
Dr Soltan's research also mapped the home postcodes of patients who ended up in hospital in Birmingham.
What we found is that patients who presented with underlying health conditions are more likely to have the most serious outcomes from coronavirus. And actually, when you go back to look at where those patients came from, they were statistically more likely to come from regions of highest deprivation.
You know, I'm beginning to get a much clearer picture of why certain communities have been more heavily impacted.
I now understand quite how much having an underlying health condition can worsen the impact of COVID. But I've also discovered that there seems to be a link between having these conditions and where you live.